Hi guys, today we're going to talk about atrial fibrillation. Before we talk about that though, let's talk about the normal sinus rhythm. When the sinus node fires, it's always regular, unless of course there's something wrong with the sinus node. So if you're looking at a normal sinus rhythm on a rhythm strip or on an EKG, you can generally predict where the next beat is going to be. You measure from the top of the R wave to the top of the R wave. From the top of the R wave to the top of the R wave. That's the same distance as the one before. From the top of the R wave to the top of the R wave, same distance as well. So you could generally predict that the next beat is probably going to be about here. That's where the R wave will be. You can predict that because the normal sinus rhythm is a regular rhythm. Atrial fibrillation is not. Atrial fibrillation is caused when impulses are coming from all over the atria and depolarizing the tissue so fast and so irregular that the atria actually cannot contract. And that quick depolarization is actually what causes the artifact or the wavy lines in the rhythm strip. The AV node can only let so many of these impulses through, but it's being bombarded so quickly. And that's how you end up with the irregular rhythm. In order to prove it's irregularly irregular, measure from here to here, R to R, but it's not the same as R to R. And that's not the same as R to R. And that's still not the same as R to R. Therefore, I cannot predict when the next beat is going to be. Another sign that you're looking at AFib is that there's no clear-cut atrial depolarizations. Because the atria cannot contract, the blood that's in the atria can clot, which is why patients that have AFib are on blood thinners. Because if a clot breaks free and goes to the ventricle, in this case the right ventricle, and then out to the lungs, it can cause a pulmonary embolism. Or if it goes from the left atrium to the left ventricle and out to the body, it can cause a blood clot or a stroke. Atrial fibrillation can be episodic, meaning that it comes and goes, or it can also be permanent. If you guys are interested in learning more about AFib, I highly recommend Rapid Interpretation of EKGs by Dr. Dale Dubin. Have a good day, guys.